Welcome to the High Risk Pregnancy Training Academy, where ANMs, medical officers, and specialists come together to learn about high-risk pregnancy conditions, share experiences, and work together to ensure the best health outcomes for mothers and babies. Today, we are learning about the identification, treatment, and management of the human immunodeficiency virus, or HIV, in pregnancy. But first, let's meet our expert trainers.
Hello everyone, I am Dr. Karishma Tharyani, consultant obstetrician and gynecologist practicing in New Delhi. In this session, we shall be talking about a very important topic, that is HIV infection in pregnancy. As we all know, mother-to-child transmission of HIV is the major route of infection in children. In the absence of any intervention, up till 45% of newborns can get this infection from their mothers. But if antiretroviral treatment is started in the antenatal period, this number can be brought down to less than 5% and also have an improvement in the mother's health. So today we have with us Dr. Poonam Tara. Ma'am is a senior consultant maternal and fetal health at CFMC New Delhi. And together we shall be talking about HIV in pregnancy. Welcome, Dr. Poonam.
Thank you, Karishma.
Ma'am, my first question to you is that before we go to management of HIV in pregnancy, please tell us something about screening of HIV infection in pregnancy.
So screening of HIV or any diseases to be able to work out which women need to be referred for special care. So this screening of HIV should be done in the first antenatal visit in all pregnant women universally. So the screening of HIV has to be universal. It's actually the pre-counseling needs to go before screening as to why this test is needed and what to be done if it comes as positive. So for any screening test, the pre-counseling is also equally important. So once that test is done, which is available in all the healthcare centers, like in the form of a rapid test, depending on what is the results, if it is negative, the ANM does the normal routine antenatal checkup, and if positive, these women need to be referred to the ICTC center for further care, and there it is double checked, it is confirmed that there is a problem, there is a HIV which is tested as positive, and such women are then referred for the antiretrotherapy in the higher centers.
So ma'am, are any other tests also required in these women?
Any HIV infection, one should always be vigilant about the other sexually transmitted diseases like the syphilis, hepatitis B, hepatitis C, and other common infections which are there. Also, tuberculosis happens to be more common, so the tuberculosis should also be screened in such women. So in the ICTC, along with confirming the test, they also look for the CD4 counts because that helps in tailoring the management plan for the pregnancy.
So Dr. Poonam, in cases where the woman is HIV positive, how the ANM or medical officer is supposed to manage her in the antenatal period in a PHC?
So if the pregnant lady is found to be HIV positive, she could have been having the management or the treatment in the form of the antiretroviral treatment from before. So should that be the case, it needs to be continued throughout the pregnancy. There has to be an emphasis on the compliance plus the educating the family members as to give this patient a good diet, exercise, rest. It is also important to check the partner of this patient, and the approach has to be family centric where the family members are also offered a test for the HIV. If the patient has not had, or it's the first time that's been diagnosed in pregnancy, these patients need to be referred to the ART center for the treatment and followed by the counseling. Every time an ANM visits the patient who is HIV positive, it is important to ask them of particular history of unexplained fever or fever which has been persistent for a very long time, any swellings that the patient has noticed, cough which is persistent, or sputum which is got some blood in it. Okay, so these are very important symptoms which should be asked directly, and if possible to look for any swelling in the axilla, neck, groin, to be able to make sure there's no lymph node enlargements. Temperature recording could also be done, and not to forget that antenatally whatever is needed, the surveillance which we do for all pregnant women should continue. So the folic acid supplementation, as also the blood pressure recording, needs to be done on a regular basis.
Dr. Poonam, there is so much stigma attached to this disease amongst women, amongst families, in the society. What is the role that an ANM or medical officer can do by basically counseling the family of such a patient?
Education is the most important thing, educating the public, educating the family members, educating the lady herself. So it has to be told to them that this is a disease like any other medical disease, and it is important that it doesn't really get transmitted to the baby that she's carrying. And the family members as well are protected. So this will only happen if they understand how the disease actually spreads. So very quickly, just to be able to enumerate, blood products, needles can cause the transmission to happen. As also intercourse can be the reason for it. Maternal child transmission is also an important reason why children are getting affected by HIV, and that's the reason why this screening has to be universal, so that the babies are looked after, given the prophylaxis as is needed, and they become free of the disease early on.
So this is a very important message that Dr. Poonam just gave us, that irrespective of what level of healthcare you are, every healthcare worker plays a very important role in counseling the women and their families about HIV infection. Such women are not to be stigmatized. They need to be given proper nutrition, proper rest, medication. The role of regular antenatal visits and visit to a specialist has to be emphasized in these cases. Dr. Poonam, in a woman who is diagnosed to be HIV positive on antiretroviral treatment, what are the situations when a medical officer should refer this patient to a higher center during the antenatal period?
So the medical officer has to take a very good history as to when the symptoms had started and when the treatment has started, whether the patient is compliant to the treatment. You should make sure that all the direct questions about swelling in the body, or persistent fever or cough with sputum and blood. So these direct questions need to be asked as to whether to understand if it's not deteriorating her condition. Along with this, certain blood tests needs to be done, like the kidney function tests and liver function tests. Also the CD4 count, if it's not been done for a while. It is important to have the CD4 count, because if it is less than 250, then a treatment has to be started for the pneumococcal, for the opportunistic infections, which is the Septron, which is given with folic acid. It is also important that while the women is being managed, the baby was also looked after. So the level anomaly scan or the level 2 scan is done if the baby is okay with respect to the weight and the anomalies to be checked. So once all these things are looked into, if the patient is doing well, then the medical officer can look after the patient, having told her to register her case into the tertiary center where she would be delivering. Or if the medical officer thinks that the condition is deteriorating, then the referral becomes more faster.
Basically, in all situations where a woman is having adverse effects to ART, or if she is showing abnormalities in her lab work, like a fall in hemoglobin or fall in her blood counts, or if there are any signs of the fetal growth not being well.
Right.
In such cases, the medical officer should refer such a patient to a
Tertiary
higher
center.
center. Dr. Poonam, can you throw some light on antiretroviral treatment that we've been talking about for so long?
So the antiretroviral treatment includes a triple drug regimen which needs to be followed throughout the pregnancy. This can be started at any point in the pregnancy. The earlier the better, but even if the patient comes in labor and diagnosed to have HIV positive, this needs to be started. It is important to emphasize that these medicines, the side effect of it is minimal to the baby, and in fact the vertical transmission rate from the mother to the baby reduces to as low as 1% if it is done in the right way.
For all the women who are HIV positive, the clinician should know that these medications are mandatory, they are free of cost, and they cause minimal side effects to the baby. So if you tell this to the patient, the compliance automatically increases. Dr. Poonam, can you tell us something about why these women should be delivered at a tertiary level hospital, and what about the mode of the delivery? Is there a specific mode of delivery that these women should only have cesarean sections, or can they also be delivered vaginally?
The reason why they should be delivered in the tertiary setup is because there are certain medicines that need to be given, as also the protocols that need to be followed. So these women, it's important to avoid certain things, certain conditions like prolonged rupture of the membranes, prolonged augmentation of the labor, not to use anything which is invasive in terms of fetal monitoring, try to rupture the membranes little late than early, and when the baby is delivering, try not to deliver instrumentally, and if instruments is needed, prefer a forceps over the one-tooth delivery. As soon as the baby is delivered, the baby needs to be handled by the neonatologists who are actually dealing with such problems on a regular basis, because the prophylaxis needs to be given to this baby. So there are certain things that needs to be followed, and which is much more easier if done in a tertiary setup. So the prophylaxis needs to be done for about 6 weeks, and it can be extended if there are certain complications that is there in the pregnancy, or the patient has started, the women has started the ART little later, or there is a concomitant other infections. So these are much easier to handle in a tertiary setup.
So that's a very valid point that you've made here, Dr. Poonam, because a lot of HIV positive women are scared of going to the hospitals because they think that they'll be forced to have a cesarean section. So what is to be remembered here is that it is not the only mode of delivery that can be done in these patients. Dr. Poonam, please tell us something about the postpartum care of HIV positive women and the controversy regarding breastfeeding.
Postpartum care is on the principle that whatever treatment she is on needs to be continued throughout the postnatal period. It is important for her to understand that with the antiretroviral treatment, the chances of her transmission to the baby is far less as compared to when she does not take the ART. So the compliance has to be maintained, and this is what the A&M has to keep checking after she leaves the hospital to go to home. HIV positive women should be counseled for breastfeeding, and the advantages and the disadvantages of breastfeeding should be discussed with the patient. It is a good option if done exclusively, maintaining the ART therapy in the regular manner while breastfeeding and thereafter, as also to continue to have the hand hygiene and to be looking after the breast well. If she is undergoing breastfeeding, she has to be sure that it is not a mixed feeding which she is doing. It has to be an exclusive breastfeeding, and if all precautions are dealt with, it is likely that the vertical the transmission rate becomes far lesser, and the baby can continue to be healthy.
Thank you, Dr. Poonam, for such an enlightening session. You have made it so clear to us that HIV positive women are not to be stigmatized. Screening for all antenatal women is universal. Diagnostic tests for HIV are easily available. Antiretroviral treatment is easily available and free of cost at all healthcare centers. Such women should be encouraged to have regular antenatal checkups and institutional deliveries. After delivery, early infant diagnosis and neonatal prophylaxis should be given prime importance. These women should be counseled for exclusive breastfeeding if they are willing. Mixed feeding should be discouraged. By following these simple protocols, the risk of mother-to-child transmission can be brought down to as low as less than 2%. For details of management of HIV-positive pregnant women at different levels of healthcare and for details on antiretroviral treatment, please do have a look at our protocols.
Thanks to our expert doctors, we now know about identification, management, and treatment of HIV in pregnancy. Remember to refer to the protocol for more details.